Can an H. pylori vaccine stop ulcers? Have you ever wondered if a vaccine could help prevent ulcers? This question leads us to explore the role of Helicobacter pylori, a bacteria that is a major cause of peptic ulcers. Peptic ulcers are sores that develop in the lining of the stomach or the upper part of the small intestine. When H. pylori infects the stomach, it can lead to chronic inflammation and, ultimately, ulcer formation. Developing a vaccine against H. pylori could potentially prevent these ulcers by stopping the infection before it starts. However, as of now, there is no approved vaccine that can reliably prevent or treat H. pylori infection. Research in this area has been ongoing for many years, but clinical trials have yet to produce a vaccine that is effective in the long term or has received regulatory approval. One of the main challenges in creating a vaccine for H. pylori is the complexity of the bacteria itself. H. pylori has a unique ability to persist in the stomach lining, making it difficult to target. Vaccine candidates have been developed with the aim of either preventing initial infection or modulating the immune response to reduce inflammation and the severity of disease. Ideally, a prophylactic vaccine would be administered to young children before they become infected. However, many people are already infected by the time they receive any vaccination. Therapeutic vaccines are also being explored. These would help clear or control existing infections. Recent advances in vaccine research include experimental vaccines that use bacterial carriers or novel combinations of antigens. Unfortunately, these have shown limited protective effects in human trials so far. Excitingly, new approaches are being investigated, including the use of artificial intelligence to design precision-targeted vaccines tailored to different strains of H. pylori. This could help overcome some of the current limitations and improve vaccine efficacy. In summary, while the idea of an effective H. pylori vaccine is promising and could theoretically prevent peptic ulcers, such a vaccine is not yet available. Ongoing research is crucial to finding safe and effective vaccines that could reduce the burden of H. pylori-related diseases, including ulcers and gastric cancer. Until a vaccine is developed, preventing the spread of H. pylori through good hygiene practices and appropriate antibiotic treatment remains the best way to manage ulcer risk. Always consult healthcare professionals for personalized medical advice regarding ulcers and H. pylori infection.